We have breaking news on vaccines from overseas. Research from the University of Oxford in England out this morning has new data regarding those rare cases of blood clotting in COVID patients and vaccine recipients.
Okay, guys, good day. This is from MediaSmartGuy TV, and we are going to discuss and check out this video with breaking news from CBS. Okay, it's about a new study on vaccines and blood clots. Oxford University in the USA has just newly released the results of that study. Okay, so let us check this out.
CBS News medical contributor Dr. David Agus joins us. David, good morning. We need to point out that this study has not yet been peer-reviewed, but what do you make of it?
So this is a study where they pulled data from large numbers of hospitals, predominantly in the United States. And the most, I think, important finding is...
Take note, guys. First, this is just newly released research results from Oxford University, and it has not yet been peer-reviewed. When you say not peer-reviewed, it doesn't say that it is invalid or it is not real or correct. It is just that the results have not yet been read or critiqued with other experts in the field of medicine, especially COVID-19. Another fact that we should stress out before we continue is that according to this news, this Oxford University research is predominantly taken from large numbers of patients from USA hospitals. So predominantly. In fact, it doesn't mention about Asia or let's say like Philippines, our country, or in other parts of UK, or other countries like that has also high incidence of COVID-19 like Brazil, and also other European countries. So basically this is USA based research, and the people who were subjected to this research are also COVID-19 patients from the USA. Okay, let's proceed.
Is that this particular blood clot in the brain called cerebral venous thrombosis happens 10 times more common in people with the viral infection than with the vaccines. And this was very important.
Okay, so first, one of the highlights of their research tells us about the blood clots. Of course, this is the main issue. Now, the blood clots, specifically as the doctor discussed, it is cerebral, venous, sinus thrombosis. Okay, now four words. Okay, or it just simply means cerebral thrombosis. Okay, although it is a rare type of stroke, wherein, if you remember your anatomy physiology, your venous sinuses are the ones that are the pathways of the blood that is leaving your nervous system, or shall we say your brain, because it is the pathway wherein blood, the venous blood, is being drained and going back to your cardiovascular system for oxygenation, for circulation and eventual oxygenation. Now, what happens is, in this, just a very short idea about CVST, so that you will have an idea about it. What happens is, if there is thrombosis, cerebral thrombosis in one of the venous sinuses, there is a blockage. It blocks, because when you say thrombosis, it's a clot. or blood clot. Now, what happens is the blockage will cause a seepage or leakage of fluid, venous fluid, back into the brain, and this will further cause your internal bleeding. And this internal bleeding would worsen and lead to hemorrhage. And this would lead to other neurological disorders like coma and eventual death. Okay, so this is what has been the talk of the town, especially about those who are having issues and having doubts about taking vaccines because of the news reports, and as well as those what they have heard that there are patients who have been newly vaccinated who died because of cerebral tumors or cerebral blood clots, and just after a few days or a few weeks from initial and even second dose vaccination. Okay, so this is the study that will give us a more idea about the real truth about this issue on blood clots, your cerebral venous sinus thrombosis or cerebral thrombosis, and the vaccines that are currently available in the market. Let's proceed. And also, as he said initially, it has been found out that the occurrence, as we said, CVST is already rare, but in occurrence, it has been found out, as I have heard in other news, that there it is around 4 to 5 patients in every 1 million being vaccinated. That's the occurrence in relation to Pfizer vaccine, Moderna vaccine, and Astrazeneca vaccine. More or less, around 4 to 5 patients will have or did have CVST or blood clot related problems after vaccination. But according to what he has just said, it has found out that those who had or is currently having COVID-19 has even more dramatically higher percentage of having CVST. If I heard it right, he said 10 times greater incidence of CVST or cerebral thrombosis among patients with COVID-19 as compared to those who took the COVID-19 vaccine. Let's try to continue.
So people with the virus have a much higher incidence of this particular kind of rare blood clot in the brain.
But David, the study also shows that Moderna and Pfizer vaccines have a similar rate of blood clots as to AstraZeneca and Johnson & Johnson. So what does that mean?
Yep.
Okay, let me move my picture video so that you can clearly see. Okay, if you look at the illustration and their Oxford study results, blood clotting cases that occurred in relation to Pfizer or Moderna vaccine, there are 4 incidences. In other words, 4 patients after 1 million was vaccinated. And AstraZeneca vaccine, there were 5 cases of patients who had blood clots or blood clotting cases after 1 million has been vaccinated. So that's the result. Now, let's continue.
What we're seeing is that this is an effect of all of the vaccines, is that about a tenth is common. In this study, there were 2 in 500,000 people with the Moderna and the Pfizer, so a rate of 4 per million, so actually more than the Johnson & Johnson, but dramatically lower than if you had the virus. And it's an important observation, and I think it's going to change now because we're going to be able to prevent these and treat these early as we develop strategies.
Yeah, but how should the government respond?
Okay, so Dr. Agus, the medical expert of this research study, really told the anchorman or the in this news or video that there is really an occurrence of such CVST in some cases, like 4 patients or to 5 patients. But he was very optimistic that if we just continue the vaccination, we will have an improved mechanism of or strategies in order to create more vaccines in the future that will be able to lessen the occurrence of this CVST or cerebral venous sinus thrombosis. Can we just call it cerebral thrombosis? Because it just means the same. So cerebral thrombosis. So, but he still emphasizes that vaccination is very important. Okay, and that we as citizens of this world should have the responsibility and the courage to take these vaccinations in order to put a stop to this COVID-19 pandemic as soon as possible.
In this case, David, they paused the Johnson & Johnson vaccine. Is that something they need to consider with the other vaccines?
Yeah, no, I'd say that's a critical point. My gut is that the Johnson & Johnson vaccine will be continue to be administered after the committee meets again in a week. The advisory committee met yesterday and said they'll make a decision in 7 to 10 days. And my gut is
now currently the Johnson & Johnson vaccine has been stopped or suspended because of this blood clot related side effect, or shall we say adverse effect of the vaccine. And according to him, Dr. Agus, he is one of the experts, that probably the experts in the USA would reconsider. And in fact, he's mentioning that within 7 to 10 days they will reconvene, and probably he is very optimistic that they will reconsider the suspension and again use J&J Johnson & Johnson vaccine, because the benefits of taking the vaccine dramatically far outweighs the risk of having cerebral thrombosis.
we're going to get back on the vaccine train here and vaccinate people to prevent the horrible complications from the virus. I think this is more evidence of the vaccine helping people in a dramatic way from the ravages of COVID-19.
The headline again, David, as you said, is that you're more likely to get blood clots from the COVID virus, significantly more than you would from any vaccine. Dr. David Agus, thank you very much.
Yeah, but it is confusing.
Yes.
So that's it. As in conclusion, what we can take from the breaking news is that it has been proven by scientific research from the Oxford University that indeed there is the occurrence of CVST. It is just not a gossip. It's really true that CVST or cerebral thrombosis can occur, although it is very, very rare because the occurrence is just 4 patients to 5 patients in every 1 million that is vaccinated. But if you don't vaccinate because you are fearing for that, if you get the COVID-19 virus or you get sick with COVID-19, you have far more danger. Why? because according to the study, if those who are COVID-19 patients or those who gets COVID-19, whether it's mild, moderate, or severe, they have the possibility or chance of more than, it's around 10 times compared to those who took the vaccine. So, in other words, there is greater risk of contracting or having CVST or cerebral thrombosis if you get COVID-19. So, in other words, bottom line, get the vaccine because the vaccine is the better option and it dramatically far outweighs in comparing the benefits and advantages of the vaccine far outweighs the risk of taking the vaccine. So I hope you guys would take your get yourself listed and take the vaccine as soon as possible so that we can attain the herd immunity as soon as possible and live a good life, healthy lives without COVID-19 anymore. Let's stop COVID-19 pandemic. Thank you. Have a nice day.